through our year-long virtual conferences and custom marketing services. Our conferences offer a unique combination of industry expertise and extensive consumer research and analysis, ensuring sponsors visibility to the right audience of our senior executives throughout the year. Connections, the premier connected home conference, is celebrating its 25th year and hosting more than 1,300 senior executives from the smart home, security, connected health, energy, and home automation industries during sessions throughout the year. Our 12th annual Smart Energy Summit addresses the evolution of the customer utility market, the impact of COVID-19, and new opportunities to drive engagement in utility-sponsored programs and energy-efficient solutions. Parks Associates' 8th annual Connected Health Summit addresses opportunities for connected health solutions to empower consumers, caregivers, and providers to meet the growing demand, independent living, chronic care management, remote access, and wellness and fitness solutions. Our 4th annual Future of Video, OTT, Pay TV, and Digital Media brings together senior leaders to share insights on consumer adoption, churn, and spending on services, including the role of the connected CE in the growth of video viewing. If you are looking for new ways to engage with our audiences, increase your brand awareness, and network with our industry leaders, I would love to share with you on how to partner with Parks Associates to help provide your brand more visibility.
If you miss a live session, you can go back at any time to watch on demand. Go to Watch Replays and click on the session that you want to view. Have you created your own event agenda and swap card? Visit the Agenda and Watch Replay tabs to add sessions that interest you to your own event. You can go back to My Event to revisit any bookmarked sessions, sponsors, and items. We want to make sure that you're connecting with our industry-leading sponsors. You can interact with them by visiting the Booths and the Sponsor tab. You can also bookmark sponsors or add items to your event to view later. Sponsors have uploaded extra materials for attendees. Make sure to visit sponsors that interest you to chat with one of their team members or save documents for later. We have dedicated meeting slots set up for break times between sessions. Continue the discussion by requesting meetings from others in the Swap Card platform. Schedule a meeting with another attendee or a sponsor by visiting their page. The panelists and speakers will be addressing your questions live during the stream. During the stream, use the question tab to ask your questions early in the presentation. Go to the poll tab to answer polls that will be discussed during the live stream. If you need help navigating Swap Card, please reach out to our team by mentioning @Parks Associates in the chat box or by contacting one of our team members via our company page. Hi, we are excited to welcome you to Parks Associates' 8th annual Connected Health Summit. Typically, we host the Connected Health Summit at the end of August in sunny San Diego. The event takes place across 3 days, including a night out at the ballpark. But this year, like last year, everything is different. Instead of hosting across 3 days, we will bring Connected Health Summit to you across the year, featuring virtual sessions focused on the impact of COVID-19 on the connected health market and current consumer attitudes towards virtual care and remote monitoring solutions. 2020 was an unprecedented year in healthcare worldwide. The COVID-19 outbreak and resulting public safety measures led to sharp decreases in in-person visits, the delay of many elective care procedures, and dramatic changes in how healthcare is accessed by patients and delivered by providers. This year's event, Connected Health Summit, Consumer Engagement and Innovation, addresses opportunities for new solutions, including smart home platforms, telehealth services, voice assistants, and wearables to empower consumers, caregivers, and providers with new insight into patient health. Providers must rise to meet the growing demand for services in independent living, chronic care management, remote access to care, and wellness and fitness. New business models, technologies, and solutions are providing a more consumer-centric experience. Telehealth and independent living solutions are extending healthcare and enabling care delivery to a larger market, with specific impact on elderly, patients with chronic conditions, rural households, and caretakers. We look forward to sharing more of our research across the year and bringing you the industry leaders in the connected health industries. We look forward to seeing you in these coming events.
Hello, and welcome to today's Connected Health Sessions. I'm Jennifer Kent, Vice President of Research at Parks Associates. Today, we'll be taking a deep look at the smart home as an environment that promotes the health and wellness of its residents. With more time spent at home than ever under pandemic circumstances, consumers have new concerns about the health and safety of their home environments and that of their loved ones. In this session, we'll address how companies across the connected home ecosystem address these concerns while also adding to the smart home experience. Before we get started, I want to thank our sponsors, Alarm.com and Everise, for your support. You can connect with our sponsors directly through the Swap Card platform for more information on what they are doing in the connected health and connected home spaces. This year, Parks Associates events are virtual all year long, as you heard Elizabeth mention. Connected Health Summit, of course, as one of them. And while we miss you dearly, this does allow us the opportunity to host sessions and conversations throughout the year. So today, we're tackling the smart home, healthy home this morning. And then we have a second session this afternoon discussing the opportunity to better serve seniors and caretakers at home. Later in the year, we'll cover topics such as the impact of AI in the connected health arena, virtual health and remote monitoring, new business models arising out of the pandemic experience in the connected health market, the role of the tech giants in driving healthcare innovation, and the incredibly important and always challenging issue of health data interoperability. So please join us all year long for these discussions. During this session, we'll start with a presentation from my colleague Keshav Jaiswal on what we're hearing from consumers in their new concerns and demand for products that help them live healthier lives at home. Following that, we'll hear a visionary insight talk from Paul Shalla, CEO of Delos. Then Parks Associates President Elizabeth Parks will host a Q&A session with Karsten Russell Wood, who's the Executive Director of Portfolio Management with Philips. Then I'll be back to moderate a full interactive panel with industry leaders from A&D Medical, Sleep Number, Aprilaire, and Omron Healthcare to hear their experiences and their perspectives in promoting health and wellness at home. In the panel discussion, and as well across all of our speaker sessions and speaker talks today, we do encourage you to submit questions in that questions tab in the smart home platform, and we'll incorporate your questions throughout our discussions. Following our panel discussion today, we'll open a Zoom chat room, and we invite all of you, all of the attendees and our speakers to join us there. We have a full half hour of networking time within that Zoom room to chat and discuss what we talked about and what you're experiencing out in the market before we launch into our afternoon session at 12:30 Central. With that, let's dive right into our first presentation with my colleague Keshav.
Thanks a lot, Jennifer. Hello, everyone. Welcome to today's session of Connected Health Summit 2021. I'm Keshav Jaiswal, part of the in-house analytics team at Parks Associates. Having an analytics background, I'll be taking help of our consumer and B2B survey data to examine the potential of leveraging the connected health devices and smart home devices for overall healthier home. In today's session, I'll discuss how connected device ecosystem is creating new opportunities in residential building sector and how changes inspired by COVID-19 are making homes smarter and healthier. Smart home technology started its life as a way to upgrade our households, with IoT telling one device how to operate another one without any human interaction. But in an age when technology can reduce the need to touch surfaces and therefore the risk of infection, contactless living has become a necessity rather than a luxury. Now, a smart home is also a healthier one, evolving to keep you safe and well within your own four walls. Smart home devices and connected health devices are two main tent poles of a well connected and well functioning device ecosystem. Adoption of connected health devices, defined broadly, is growing year over year. 42% of US broadband households report owning at least one connected health device as of Q2 20, up by 24% when we first started collecting data in this vertical back in 2013. While the overall adoption of connected health devices is growing at a steady rate, consumers own more connected health devices on an average than ever before. The average number of connected devices owned is on an upward trajectory and has doubled in last 2 years. Smart home market has seen some gains in 2020 despite pandemic conditions. More than one third of US broadband households now own a smart home device, but up from 29% in Q4 2019. This growth comes not only from expanding the number of households buying their first smart home product, but also an expansion in the range of smart home products available today. Purchase rates have held steadily with 2019, even though households reported higher unemployment, difficulty paying bills, and a little bit conservative spending in general. Product pricing continues to drop, which bodes well for more uptake among early majority who are more cost conscious than innovators and early adopters. The smart home sector is proving to be resilient in face of a challenging market and changing household patterns. As consumer spending returns to pre-pandemic patterns later in 2021, expect a modest continued growth in the smart home market. The hierarchy of smart home products installed as a standard in new homes roughly mirrors general consumer adoption. Many smart home model of products are replacing the traditional versions as standard and not merely offered as an upgrade. One-fifth of large-scale builders report that smart home technology is the most important value-added feature. While energy efficiency and flexible floor plans are well-established features for new homes, a solid majority rank smart home technology among the top three most important features. Healthy home features such as indoor air quality provide an emerging value-added strategy for the builders. Over a third of production builders rank these features as top three. We see major home builders moving forward with these new initiatives. A few examples we note from a recently published Builder Online article include Taylor Morrison, one of the top 10 large home builders introducing whole home air filtration and water filtration as standard. Red Tree Builders, a builder out of North Carolina, starting to emphasize on health and wellness benefits instead of energy efficiency benefits and getting more response with the value proposition than just energy. And Three Roots, a development with Leonard Share Homes in California West, where the entire development is focused on wisdom, wellness, and wonder. Not surprisingly, like large-scale builders, small to medium home builders are including smart home features in their new homes, which is an important indicator that smart home devices have established a place in the traditional single-family building sector. Similar patterns can be seen in MDUs. Multifamily builders report that smart home technology is as popular as some traditional amenities or features such as fitness center, swimming pool, or hardwood flooring. Evidently, smart home technology has become an expected amenity among renters or multifamily units. Increased rental revenue is the most important smart home value proposition for these builders. Understanding both revenue drivers and operational savings for property managers and owners will enable the smart home technology sector to provide multifamily builders with best solution to meet their needs. To address the multifamily builder segment, smart home manufacturers and middleware providers need to invest in expanding the ecosystem of software partners. Although the popularity of smart home features has been growing year over year, COVID-19 pandemic has inspired many changes as consumers have seen an increased time spent at home. When social distancing became the norm, smart home technology was there to deliver, ready to automate our lives with IoT. 1 in 4 US broadband households report changes to indoor air quality or water quality due to the COVID-19 pandemic. With more time spent at home than ever before under pandemic circumstances, consumers have new concerns about the health and safety of their home environments. This opens up an opportunity for device manufacturers and service providers to help consumers in making their home a smart home, a healthier home. There is an ever expanding ecosystem of smart products that can enable a variety of health and wellness use cases at home. Thinking about all the device types and variety of data that they collect, a number of new possibilities for connected health use emerge. From the more established use cases like remote patient monitoring for chronic conditions, to devices like smart mattresses improving sleep quality, connected fitness devices like the Mirror and Peloton, robot vacuums for providing cleaner homes, smart kitchen appliances assisting in healthy cooking, and smart devices to help consumers breathe better. As we shift into a post-pandemic world, the demand for healthy homes and superior air quality has exploded. Clean air is vital for overall home health, making air quality sensors and indoor climate products essential for a healthy living. 1 in 5 consumers are very concerned about their air quality. Overall, 34% of US broadband households are concerned about the air quality inside their home. Air pollution and air quality are important health concerns. It is widely known that extended exposure to air pollutants can enhance the risk of respiratory diseases and even premature death. As consumers spend more time indoors, especially during the COVID-19 pandemic, concerns around indoor air quality and health becomes particularly important. Poor air quality has been linked to a wide variety of health effects such as headaches, difficulty sleeping, dizziness, and respiratory conditions. Dust and allergens top indoor air quality concerns. 37% US broadband households are concerned about dust and allergens inside their homes. While an increase in pollen and allergens outside keep those with allergies indoors, these substances can be found indoors as well. Proper filtration can help reduce and control indoor allergen concerns. 1 in 4 US broadband households are concerned about virus and bacteria. This has been accelerated with COVID-19 and need for a superior ventilation. Improved indoor air quality can be effective in reducing airborne virus transmissions. 47% of US broadband households have experienced an indoor air quality related health condition, and allergies take the lead. COVID-19 has shed some light on the impact of poor indoor air quality and need for proper ventilation. Improving awareness and familiarity of indoor air quality beyond those with health conditions will help the overall adoption for this category. Over half of the broadband households find a smart product that removes dust allergens from the floor and purifies the air of viruses and bacteria as valuable. 20% of consumers are highly concerned about the air quality, and about 20% own a smart climate control device. This illustrates that ownership is driven by those highly invested in indoor air quality. To reach mass market adoption, awareness of both indoor air quality problems and solutions must grow. Simultaneously, the prices will need to drop and become more affordable for an average consumer. Thermostats have the highest adoption rate and purchase rate by a wide margin among the smart climate control devices. Smart thermostats have been in market for over a decade now, and the adoption is yet to reach a saturation. Marketing efforts of Nest and entrance of new players like Wise and Zmodo in the space continues to attract new customers and raise awareness with the potential of increasing purchase rate for the category as a whole. About 40% of US broadband households report high intention to purchase smart home device, while 31% report being an active shopper, which is slightly higher than those likely to purchase an indoor air quality product. 19% to 21% of US broadband households are very likely to purchase a smart climate control device or an indoor quality device in next 6 months. While purchase intentions provide directional value, it is very important to note that intentions may not be realized. Several factors serve as barriers to intention for these climate devices, including poor perception of value, low familiarity, and price sensitivity. If you'd like to find more about these data points, I would suggest keeping an eye out for our latest quantified consumer report on fresh air quality in and comfort in smart home, where we have examined most important concerns around air quality, value of benefits and solutions, current adoption, purchasing rate, consumer segments, and impacts of smart product adoption on this category as a whole. If you have any questions regarding the quantified consumer product, or if you would like to discuss more about these opportunities I discussed in this session, please feel free to leave a question in the chat box. Thank you and have a great day.
Certainly. Oh, thank you, Keshav. The data certainly adds context to the opportunity ahead of companies in this market to really build meaningful wellness applications and solutions for our home. Up next, our next speaker has really led that discussion for the industry. Paul Shallett is the CEO of Delos. After 18 years on Wall Street, Paul's interest in sustainability and altruistic capitalism led him to found Delos, which is merging the world's largest asset class, which is real estate, with one of the fastest growing industries, which is wellness. Since the company's inception, Paul has really become a leading voice in the wellness and sustainability movements. He's also the founder of the International Well Building Institute, which administers the well building standard globally to improve human health and well-being through the built environment. So hello, Paul. Great to have you with us today.
Great to be with you. Can you hear me okay?
I sure can. Thanks so much. We're very excited to hear, your perspective and what Delos is doing in this pretty incredible time as we all focus more at health and wellness at home.
Absolutely. Pleasure to be with everybody. I'll give you a little bit of a history of this well building movement and really how things started and where we are today. It's quite interesting. Delos has been merging the health sciences with the building sciences for almost a decade. And the first half of that was pure research. I literally remember the day over 10 years ago writing the 3 words wellness real estate on a napkin as an idea. Could we actually take the world's largest asset class, real estate, and infuse it with the world's fastest growing industry, health, wellness, prevention, and nowadays even health safety. We took our time. We did a lot of work to really look to connect the medical professional with the building profession. So getting doctors together with architects, engineers, designers was really the inception of Delos itself. Perhaps we can move to the next slide. Great. This is really important, guys. With all the time we spend indoors, in fact, over 90% of our lives inside of a box called 4 walls and a roof. It's interesting to look at what that really means from our health outcome standpoint. And, for the first, again, 4 or 5 years of our platform, we put over $100 million of research capital together, pulled in Mayo Clinic, Cleveland Clinic, hundreds of doctors of different disciplines, got them together with the real estate professionals, owners, operators, developers, architects, designers, engineers, really to look at our indoor environment and go deep on everything we could see that surrounds people inside and directly link that to our health outcomes. So looking at air quality, water quality, lighting, thermal, acoustics, biophilic elements, surface and cleaning protocols, operational policies, mapping all of these directly to our respiratory, cardiovascular, immune, cognitive, digestive, and sleep health outcomes. And what we found is something quite fascinating when you consider chronic health outcomes. About 5% of anyone's projected chronic health outcomes are genetic. And we can't do anything about that, at least not yet. Another 20 to 25% is determined by our lifestyle and care. And here's what gets really interesting. The rest, up to 70% of all health outcomes are determined by our surrounding environmental and social conditions, basically where we place ourselves, which means basically inside, whether that's our homes, our offices, our schools, what have you. But when you consider all of the elements that surround us and how impactful those are on our health outcomes, it's really important to take an evidence-based approach to understand how to help optimize our surroundings indoors and how that can lead to better health outcomes for all. And it's going to be done at a societal level. Next slide, if you would. So, I think we're going to see a lot of this, and this is emerging. And again, it's certainly, I could tell you, having done this for a decade, this was a learning curve that took a long time for folks to really get to realize that you can actually enhance your health outcomes through your home, through your office, what have you. And unfortunately, it recently took a global pandemic for people to realize one very simple thing: that what surrounds us matters. What we touch matters, what we breathe matters, how we gather indoors at times matters. Lighting impacts our sleeping patterns. Obviously, air quality impacts our respiratory outcomes. And so obviously we're seeing a big jump in this theme of healthy home. Next slide, please. I think, again, with this notion of diving into what surrounds us, what Delos did initially in 2015 was introduce the Well Building Standard. And that has become the world's largest certification body for healthy buildings. Our Well Building Standard is now in 81 countries, and it covers almost 2 billion square feet of commercial real estate. And certainly there's been a lot of demand now for us to look heavily at a standard for homes, for single family homes. And we're super excited to be putting a construct together for a well certified designation for home builders and all types of homes in the residential and particularly single family space. Diving into these things, this also has a direct link into smart home. And as we started to understand the health domains that matter and using access and resources such as our Well Living Lab, which is a 50-50 founding collaboration between Delos and Mayo Clinic, where we actually can simulate indoor environments and test various interventions to really get to the right blueprint as to what systems matter, what system architecture could matter, what types of products can be invited into that type of system to really turn smart home into smart, healthy home, because a home is not smart if it's not healthy. Next slide, please. So what really came out of all that work is a platform we put forth, which is what we call a wellness intelligence network. We call Darwin. This really kind of strikes the same chord as the fundamental principles of the entire well building movement. In fact, the well building standard and its categories of air, light, water, thermal, acoustics, these all make up the foundational blueprint of a system that is made up of a whole library of algorithms and commands and controls, and what I would call a layer of wellness intelligence, when you can actually understand the impact that lighting has on sleeping patterns, or that air quality has on cognition, performance, and respiratory outcomes. Obviously, the core fundamental basic elements of water quality. Interestingly, you can use technology to do something quite special, which is to create an intersection between the quantified space and the quantified self, thinking about all of the data points that surround us that actually can be measured and altered, and all of the data points inside of us that can be measured. Over 1,000 internal biomarkers that make up our health complex and understanding therein. It's fascinating to think of the opportunity we have today with regards to one, again, simple thought. Consider, for the better part of human history, in fact, almost all of it, call it 100,000 years plus of our biological evolution, was spent outside. We would roam the earth outdoors, wake up with the sunrise, be active and energized and productive throughout the day as that bright sky, then that light would hit our circadian optic nerve and boost hormones for energy, productivity, mental acuity, movement. We used to breathe pristine air and drink pure water. We slept in cooler temperatures versus warmer temperatures. We, in fact, slept in complete darkness. And that natural circadian pattern, that 24-hour pattern, went on. And we were generally adapting to surrounding environmental conditions. And this went on for, again, most of human history until we started building boxes around ourselves called four walls and a roof. And then ultimately introduced things like artificial lighting into our lives and started getting a lot of exposure to bright light at night, which completely disrupted our sleeping patterns and our circadian rhythms. And the fundamental understanding of our evolutionary pathway has generally been that the human condition over time, over hundreds of thousands of years, has generally adapted to surrounding environmental conditions. For the first time ever, we have an opportunity now as a collective, as an industry, when you consider our ability to put forth algorithms and commands and wellness intelligence, if you will, that can have indoor environments adjust based on what is happening to our bodies. In our work with Well Living Lab and our Delos Labs platform, we have run all kinds of regressions on the relationship and understanding of simple things like temperature versus pulse rate, lighting versus sleeping patterns, air quality versus cognition and performance, using that type of foundation to create a wellness brain, if you will, that, by the way, can be put into any existing smart infrastructure. This is an open ecosystem and open source platform of wellness intelligence that allows us, for the first time ever, to consider that we can actually now see surrounding environmental conditions adapt to the human condition. And that is a huge, huge change fundamentally. And we've been quite busy with regards to putting in place very scalable software and infrastructure with an ecosystem of hardware components, air filters, water filters, lights, sensors, what have you, that can tie into this broad wellness intelligence network that can be delivered at scale and very cost effectively into existing smart infrastructure or as a standalone system. Next slide, please. Again, just hitting on some categories here, obviously air quality and lighting and water quality and sleep. But what we found is, whether it's through the Well Building Standard and our applications of a third-party verification and certification body, or through residential applications in smart home, we can bring these things to the consumer in a manner that is seamless and ultimately really changes the paradigm of what we call a home. Think of a home, any home, a high-end luxury or a volume track house. And yes, views are nice, and location and address and school systems and floor plans and finishes, and those are all important things to consider when purchasing a home. What we feel is what is of utmost importance, and perhaps what's been missed for quite some time, is the impact that home can have on the health, well-being, and lifestyle of the occupants, really paying attention to these core fundamental principles. And it's fascinating to see the industry jump, particularly over the last year. But we've seen, probably a 5-year trend into smart, healthy automation and health and wellness in general, in terms of our spaces. But clearly, this last year has done wonders to reduce that learning curve. I bet you, if you asked 100 people in the developed world a year and a half ago about indoor air quality, you probably would get 1 out of 100 of those folks to either indicate that they had a thought, concern, care, understanding, or even awareness of indoor air quality, or the fact that, for instance, indoor air quality generally is 2 to 5 times worse than outdoor air quality anywhere you are in the world, basically. A year and a half later, that number is probably 99 out of 100 people. I don't think you're going to find too many people in any corner of the earth at this point that have not had a focus or an attention, a fear, a knowledge, or better awareness of indoor air quality. Now, obviously, that was put in the construct of a very horrific environment with regards to aerosolized particle transmission and pathogen concerns indoors, where our real estate basically became the largest carrier of a viral load, as the one we've seen with indoor aerosolized particle risk, airborne viral load, to obviously complement or go along with the surface-borne viral loads and behavioral-borne viral load. But this topic of air quality has just come smack front and center of everyone's mind. And you've got a $200 trillion asset class, real estate, that's been completely disrupted. Existing homes, existing buildings, new buildings, all basically in need of a bit of a fix here. And folks have been thrown into the need to have to play virologist and epidemiologist. And unfortunately, there are really a good lack of guidelines with regards to true understanding of pathogen transmission and efficiency. At the Well Living Lab, our Mayo Clinic Delos founded a research platform for the last year. We've been highly involved in indoor studies with regards to aerosolized particle transmission, looking at all kinds of air filtration technologies. As a standard-bearing organization, we see everything, every product, every technology, every manufacturer comes to us. They're looking for our stamp, our vetting. And in fact, Delos has been quite active and in fact has become the nation's largest solution provider, particularly in public schools, with regards to air filtration technology and the understanding therein. You know, folks throw out terms like HEPA and MERV 13 and feel like something's being accomplished, and it's discerning, because when you actually look at a viral load and you look at particularly SARS-CoV-2, the micron size of SARS-CoV-2 particles can be as small as 0.08 to 0.14 microns. A HEPA filter is rated at 0.3 microns. Okay, we have been looking at ultrafine particles for the better part of 5 years. We understand the size of this pathogen concern, and you need to go much deeper than a typical MERV 13 or a HEPA filter, or else you're only going to get about 55% efficiency on a viral load. Pathogens. Now, look, this pandemic will come and go, and others will come and go, but there is obviously a very, very heightened understanding now that something needs to be done with indoor air quality. If we can tie effective filtration solutions into smart home applications, which that's even better with regards to air remediation algorithms and a smart approach to this, such as the Darwin platform and software and wellness intelligence provides. But just the core basics here. We've been doing a lot of work educating the industry what the difference is between an ultrafine particle filter, something very effective on pathogens, versus what a HEPA filter or a standard MERV filter might enable. And the good news is there's not an extra cost here. You just need to go deeper on filtration efficiency. And so at this point, for instance, our platform has provided almost 200,000 solutions into public school classrooms, some of the biggest districts in the country: New York City, Boston, Baltimore, Miami-Dade, various districts in California. And again, where you can get to very effective scaled solutions, that's when it gets encouraging. What we've been particularly focused on for a home are both inline solutions, but also standalone solutions. Portable, wall-mounted device the size of a small fan can get you 99.97% reduction of airborne pathogens down to 0.007 microns. That's 40 times more efficient than a HEPA filter. So I think the next chapter here, after having watched this for 10 years and seeing a big general awareness and importance right now on indoor health, the next chapter is going to be the science, the evidence, and really making sure that claims that are put forth are relevant, are valid, and are effective. And that's really what we've been focused on as an organization, to provide that clarity for the industry and provide any offerings and service we can to bring forth an evidence-based narrative so the consumer can discern the difference between someone saying, I put an air filter in, versus a real evidence-based effective narrative down to a 0.007 micron, for instance, which actually is tackling the problem at hand. Happy to answer any questions anyone might have. Hopefully that was a helpful broad look at our platform.
Absolutely. Thank you, Paul, so much for your perspective. It's really interesting to see what Delos is doing, and the fact that you've had this 10-year runtime almost preparing for this moment, right? And you have so much to kind of offer in your insights and your research. We do have questions coming in for you. In fact, one really follows up just on the last point you were making about the importance of research and evidence-based knowledge that we're sharing as an industry. And so somebody wrote in and asked, could you share a little bit more about who you're working with, who's helping Delos in the building science space? You mentioned the partnership with Mayo Clinic. Are there others kind of in the circle that you're conducting research with?
Yeah, I'll give you a good example of how we approach research. And as mentioned, the initial construct was over 300 medical practitioners of all different types of disciplines, collectively with hundreds of industry professionals across architecture, design, engineering, building operations, management, even HR professionals in commercial real estate. We have now over 17,000 well-accredited professionals in 94 countries that service the well building standard. Again, that's primarily for commercial real estate, but really excited to bring this platform into the residential complex and put out a new designation, a well certified designation for single family homes, and that ecosystem of professionals will continue to build. But I think it's also important to look at a specific example in terms of how we do aggregate research partners. Yes, Cleveland Clinic led the public peer review of the Well Building Standard in 2015. Yes, we do have a 50-50 founding collaboration with Mayo Clinic in our Well Living Lab. That's in Rochester, Minnesota. But it doesn't stop there. I'll give you an example. Earlier last year, we were asked to serve a role to create a new designation called the Health Safety Rating. You may have seen this promoted, and we're getting the word out, but this is a seal on the front of any type of facility, a bank branch, a stadium, school, office, multifamily building, what have you. That was after a 4-month process led by U.S. Surgeon General Richard Carmona, 17th Surgeon General, Dr. Stacy Reza, Chief of Staff, head of Mayo Clinic staff, and over 500 virologists, behavioral scientists, public health experts, building scientists who convened in our advisory to opine on the right feature set for the health safety rating. So all of this, again, is derived and rooted in deep science. And we've got incredible access to medical practitioners and academia, and also professionals, including the building scientists around the world. And that's just kind of an ongoing mantra of ours to make sure that we have access to the right intel as we put forth programs that are conducive to such an important topic.
Are there any certifications that you're working on that are specific for seniors, whether they be senior facilities or seniors who are trying to age well and safely at home? Obviously, we track this industry quite closely at Park Associates and have for a long time, but particularly this pandemic year, the seniors are at highest risk of poor outcomes. And that isolation from family caregivers and from healthcare really exacerbated the problem. So is there anything that you're working on specifically with seniors or aging in place and assisted living facilities in mind?
Yeah, the health safety rating applies to senior and assisted living facilities. I mean, it really is cross typology. Good practice is generally consistent. Now, to your point, when you look at the occupants and the specific differences or needs, you do get into really interesting opportunities to go further. And the narrative shifts, but the interventions really don't. When you think of, for instance, circadian lighting, and you can get lighting that matches the rising midday and setting sun, for instance. I mean, that's a wonderful thing to balance sleep-wake cycles, to get you more energy during the day, more sleep at night. But the impacts that type of lighting, the appropriate lighting, particularly making sure that there's enough high lux, high temperature light throughout the day for seniors who are spending a lot of time inside, and most of the times in a darker room, it's putting the mind to sleep. Okay, you want to continue to pump mental acuity hormones to the brain, which is stimulated by the right type of light. So the circadian lighting has a different type of reason or impact for a senior than it may be for a millennial, but the intervention's the same, and that's what's exciting there. Clearly, with respiratory issues later in life, ultra purified air is more important. That demographic is more susceptible. But again, the intervention doesn't change. You want to look at ultra purified air, ultra purified water, circadian lighting, and all other categories. The sensitivity to the demographic you're looking at is obviously something that's dynamic and adjusts. But as far as a rating or a certification, the Well Building Standard and now the Well Health Safety Rating both apply to any facility, whether it's a senior housing complex, whether it's a multifamily complex, whether it's a luxury condo building or an airport, nail salon, if it's got a front door. And this is what we often say when people ask, okay, what is your platform all about? Well, what we kind of put forth is this proposition. If it's got a front door, and there's a lot of those in the world, right? Old building, new building, home, office, school, restaurant, hotel. If it's got a front door, we can either certify it, rate it, improve it with products and programming, or smarten it up with tech as it pertains to the health sciences. The good news is the human condition is universal across the world, so there are no regional differences, and that's why the WELL standard has been now adopted in 81 countries.
Yeah, well, it certainly makes sense to have that same standard of certification across buildings, but that your point about lighting and the importance for mental acuity, particularly for that segment's really well taken. We might have time for one or two more questions here. One question was really going back to your point about quantified self and quantified space, right? So when we're talking about quantified space, right, there's all of these smart home players that potentially could be contributing data and sensors and knowledge to the space, from the thermostat to anybody that's got occupancy or motion sensors, the lighting and the mattress and the building itself. On the quantified self piece, right, are you thinking that when you're talking about your own wellness platform, integrating wearables or connected health devices like weight scales and blood pressure monitors, right, and other devices that can know more about the person rather than the space? Can you talk a little more about that?
Bingo, exactly. And again, interestingly, when you think 5 years from now, we'll have sensors in our shirts, and the ability to measure real-time indicators, use that data, and then allow the surrounding environmental conditions to optimize and adjust based on that data. You can take sleeping patterns, sleep data, and we've actually have sleep algorithms whereby the input based on a person's sleeping patterns can then lead to programming the right tunable lighting to adjust and get them to sleep sooner or later or what have you. So yeah, that's exactly where this goes. It's actually where it's already gone with regards to the software and the understanding, and our ecosystem continues to grow. And importantly, this is not a closed system. This is meant to scale. We're seeing smart home providers and some of the large companies, they are looking at this and say, look, we want your wellness intelligence software and give us a sense of how many hardware components are compatible, but our ability to then accredit the industry and allow for all types of smart home players to participate in this. We're not trying to be the smart home. We're trying to be the wellness intelligence inside the smart home, and that allows for wonderful collaborative opportunities.
Yeah. I think we only have time for one more question. I feel like I have questions for days for you, but could you talk at all about the reception by builders to implement healthy home capabilities, and how are you really educating builders on customer demand and consumer demand for healthy homes?
Yeah, it's again, it was a learning curve for years, and all of a sudden, every builder under the sun is looking for advice and solutions. And I think what we're finding here is, look, it's clear the cat's out of the bag. The consumer is focused on health, and so we're going to see presentation after presentation after presentation about air quality, indoor air quality. That's all great. It's going to come down to ultimately science and rigor and the right approach, whereby, again, you'll start to get this separation between what someone calls a whole house air purifier versus an effective whole house air purifier that's backed by science, and that's going to lead the narrative. But home builders across the board are certainly recognizing that they need to put health and wellness at the center of their value proposition. And candidly, they're not medical platforms or really. I think they're taking the right approach. They're looking for folks that can actually validate their decisions and their offerings, and also message that to the consumer. Home builder XYZ is certainly going to be interested in telling a home buyer this is a healthy home. But the buyer doesn't want to hear that it's a healthy home, says the home builder. The buyer wants to hear that it's a healthy home, says an accredited organization that can validate those claims, and that's a big difference.
Yeah, absolutely. We certainly value see the value of independent research and what that means, for the consumer. So unfortunately, we're out of time. Paul Shalla, CEO of Dalos, we really appreciate your time and your insights with us today. Thank you so much for joining us.
Thanks for having me.
Absolutely. And up next, give us just a minute, and we'll be bringing in Elizabeth Parks, president of Parks Associates, with Carson Russell Wood with Philips.
Great, and welcome back. I'm, excited to hear that last conversation. If you weren't convinced about the opportunity for new solutions in the home to, play a real role in health and wellness, then, Paul just did a great job of outlining the opportunity, but also emphasizing that, this is all about execution. So thank you so much for that insight. And now I'd like to welcome another longtime expert in our industry. But again, thanks for being here. My name is Elizabeth Parks. I'm the president of Parks Associates, and we're excited for today's sessions. So today I've got Karsten Russell-Wood, the Global Portfolio Marketing Leader for the Connected Care Cluster of Philips Healthcare. We are so excited to welcome Karsten back to our virtual stage. We've got just about 15 minutes to dive into some key topics focused on the innovative products and solutions that we're seeing in the healthcare market today. So Karsten, thanks for being here, and let's jump right in and see if you can share a little bit more about your role at Philips and maybe some of the things you focused on in the past year as we've all moved through the pandemic.
Yeah, Elizabeth, thanks so much, and congratulations. What you're doing is exactly what we need to do, which is have a dialogue about what's possible. There's nothing better than Paul's segue there, because really, as we imagine what the new American home or global home looks like, it's one that's going to be connected. And that's so exciting because, from Paul's angle, we see a concept of preparedness. And what I would add there is that preparedness also is a partnership with health systems that want to move care from the hospital to the home. So it's less and less about a specific disease as it is about the system of health and care. So very excited to be here, and I know we don't have much time. So.
Well, that's great. And, that's where we want to start really, is talking about how healthcare delivery has changed and really the role that technology plays in enabling providers to really connect more directly with the consumer at home, and this move towards a more consumer-centric system. Our latest research shows now that 42% of consumers own a connected health device, 49% own a smart speaker, which is also creating a lot of integration between smart home devices through that voice control. Can you share some things that Philips is releasing to the market that are specifically being used within the home and serving consumers in a way that directly impacts their health?
Absolutely, Elizabeth. And it's good to start with realizing that 2020 was a big year. And as Philips, we are responsible across all of our portfolios, whether it was personal health, acute care, respiratory, cardiology, informatics, and telehealth, to partner in access to care. And so that's very important to realize that as an organization, Philips is spanning not only prevention, but also the management of patients in acute situations and, of course, chronic. As the home and care has changed, what we really have tried to focus on is making sure that care is accessible. In the home, we see that the traditional in-law suite is becoming the home health suite, with individuals looking to receive the care that they otherwise would have had in a PCP office, specialist office, ED, et cetera, within their bedrooms, living rooms, and offices. This solution means that consumers are more active and participatory in the care they want to receive. And some examples come in the area of expectant moms that through COVID would otherwise have to leave the comfort and safety of their homes to receive routine checkups from their OBGYN office. And in this case, Philips launched or extended their Avalon series of fetal monitoring to actually support that. So now those soothing, reassuring sounds of your unborn child can be heard in the home. And of course, the safety of the monitoring, should adverse trends be identified, can be actually reacted to proactively. That's one issue. And of course, the other, and we've all been affected by it through many different angles, is sleep. As professionals, sleep has been impacted immeasurably through COVID. Whether it's stress, whether it's added work-life balance, but also just the fact that sleep in general is something that we realize we don't do enough of. And in this angle, of course, we try and approach it holistically by looking at the different ways that we can treat sleep, whether it's a consumer-generated demand for better performance or, of course, a clinically derived one.
Well, sure. And we've done a lot of research in the area of sleep solutions and really how much that plays a role in consumers' health overall, really no matter what age you are. Can you talk a little bit more about device coverage? So we have these connected devices coming into the home. We have our medical insurance that consumers have. When are we going to see more reimbursements for these types of products? And what do you think some of the challenges are for the manufacturers who may be putting, some of these products to market and getting those reimbursement codes available?
Right. Elizabeth, I think first and foremost, it's important to recognize how significant coupling policy to reimbursement has been through COVID to achieve extensions for remote patient monitoring of certain conditions. Now, that's, of course, for medical grade equipment, such as remote patient monitoring. Very, very successful expanding it for not only chronic diseases, but other forms of diagnostic tools. In fact, what is reassuring to see is that is not just extending care for the populations that you would otherwise think, would be leveraging the platforms consistently. A recent study out of Cedars-Sinai actually showed that we're seeing a lot of other minority populations with chronic disease that otherwise may be at a higher risk for COVID, leveraging telehealth specifically in cardiology. So we know that it's working. The coupling of remote patient monitoring and the waivers allowing to be reimbursed. Now we turn that around and we look at the consumer market where ordinarily we aren't getting the reimbursement from Medicare, CMS. Here, the challenge is share of wallet. And as we see consumers become more participatory in their health, they realize that they intend to purchase technologies that can help them live a healthier, more independent lifestyle. At the same time, payers have certainly stepped in with the digital front door to engage patients and encourage them to adopt a healthier lifestyle. So we are seeing that kind of trifecta of support and advocacy, and I expect that will continue.
Well, that's great. And certainly the reimbursements end up playing a role in the distribution of these new products, whether a physician or a hospital setting is really recommending and influencing a consumer to go out and maybe make a purchase. When we talk about, consumers getting these products, can you speak a little bit towards the increase of the direct-to-consumer on the consumer-grade products versus those more medical device products, and where that might go here in the years to come?
Absolutely. And, what's interesting is, if we would kind of set a future model where we say, why are patients being treated in the med surg? Why are patients going to the emergency department? Much of that is because there's a clinical trade-off between precision and accuracy of devices that are available in the hospital and those solutions that are cleared as 510K medical devices to be used as monitoring in the home. So in end effect, it's the balance of what's available today. And I think that is the clinical dilemma and tension that companies like Philips are moving towards by helping health systems innovate through wearable technology that provides them that level of confidence in the measurement of certain parameters. Now, on the consumer side, our lives have been virtualized in the past year. And through that, our comfort and confidence in leveraging solutions such as Amazon, retail organizations to acquire, whether it's clothing, food, or even medical devices, this has peaked through COVID, and research really shows that the consumer trust in those large retail outlets is higher than the trust in technology alone. So what we can realize through that is we have a unique opportunity as consumers to adopt the same transformation that we've recognized through our move from brick and mortar banking, brick and mortar shopping and retail to a model of virtualized care delivery. And through that, care and the elements of health will become more accessible.
Well, that's great. And we certainly live in a world of I want it now and give it to me, and have a lot of the major service providers who are able to deliver on that promise. It'll be interesting to see how the healthcare market unfolds in the years to come, particularly as we know that telehealth and virtual care solutions, create additional accessibility to healthcare. So maybe you could speak towards what virtual care can do for consumers, that idea that they don't have to go into an office to see the doctor, and can receive those services virtually, digitally, or through telehealth services.
Yeah, and I think that all begins with literacy, knowing what's available and what's possible. And we find that every day, where we realize that there are individuals that don't understand what is capable to allow them to live a healthier lifestyle at the home. And that's truly because of the passive respect for the institution of healthcare. Now that's changing. We realize that individuals and consumers are more self-directed, as you said, really this me care generation, where if we would like something to occur, it needs to be convenient, it needs to be accessible, and it needs to reach me where I am. There are two sides to it. From a NASA kind of command center concept, we need systems like health systems that are decentralizing to help connect the data that's coming from these devices and support care delivery that's frictionless. On the other side, as consumers, we now have access to healthcare data, personal healthcare data, imaging results, lab results that allow us to be more targeted and specific, but also ask questions and challenge what's happening in our direction and trajectory in health and care. So I think those are converging. And of course, through value-based care, we see that the encouragement for it is also coming from a federal level as well as a payer level.
Well, that's great. And, we are at a point in time in the evolution of healthcare, and it's amazing how quickly time can go by with these conversations. But I want to get in a quick question from our audience
Sure.
before we move on to our interactive panel. So coming from the audience, can you share possibly an example of a health system or hospital which has embraced moving care into the home? And what does that look like? And can you share anything about the systems or tools that they might be using?
Absolutely. And really, I think of those visionary organizations such as Intermountain, Mayo, Northwell, and so many across the country that are really trying to adopt a new hybrid model of care delivery, which takes an existing clinical workflow and injects it with telehealth or virtual care. And so they are largely across the US adopting a virtual first mentality to how to deliver care. But we also see that CMS in November has released the Acute at Home program, which has grown almost at a daily basis by adding a new hospital. So almost at the pace of meaningful use, if you think about it. And here it's about taking patients that otherwise would be admitted to the hospital or spending a longer period of time in observation or recovery in the med surge, and literally saying you will be treated in the home with technologies that can care for you as if you were in the hospital. This new movement of acute at home is a migration. And if you would think that the centralized architecture of a hospital may find that 25% of its population is going to be treated in the home by 2025, that's an exciting North Star for us to focus on. And these organizations are absolutely leading it, especially those where they have partnered with a risk share, risk balanced organization to create an ACO.
Well, great. Thanks for sharing that. And, that'll have to be our last word. I really appreciate your time and your insights. You're just a a wealth of information. So we appreciate you being here and look forward to seeing you again on our virtual stage.
Absolutely. Elizabeth, thank you so much as always.
Great. And just here in a minute, we have our interactive panel coming up. So if you can just give us a minute. I also want to remind you all that Parks Associates is here to help you better understand the adoption and use of technology products and services. We want to help your business grow. We want to be a resource for you. We spent 35 years doing this. And so please feel free to reach out to me directly on LinkedIn. Shoot me an email at eparks@parksassociates.com if you'd like to learn more about our research, service, and products, or our events that we host. Thank you again and look forward to the next session.
In the wake of the COVID-19 pandemic, connected health solutions have played a critical role in providing consumers with remote access to care. Parks Associates Health, Wellness, and Independent Living Research analyzes the impact of COVID-19 and provides insights on market changes, including increased demand for telehealth, telemedicine, and independent living solutions, alongside the surge in adoption of connected devices by consumers during the COVID-19 crisis. The senior population is particularly vulnerable to COVID-19 and the associated isolation and pressures of distancing from loved ones. Parks Associates 2020 health research indicates nearly 80% of caregivers in U.S. broadband households have expressed concerns for their loved ones due to the pandemic. Data shows that distress over COVID-19 tops other frequent caregiver concerns, such as lack of financial resources or burglaries and break-ins. With the need to avoid exposure, consumers have adopted telehealth services as a healthcare solution during COVID-19. The use of telehealth service in U.S. broadband households jumped from less than 25% in 2019 to 40% in 2020. Parks Associates research provides trending data that gauges the demand for these services. With a desire to stay healthy and active during unprecedented times, consumers turn to connected devices and services more frequently during COVID-19. Parks Associates data reveals 30% of U.S. broadband households owned a connected health product in 2020. Parks Associates continues to study the evolution of this market with its 2021 health reports, including Healthy and Well at Home, Senior Assistive Technologies, Virtual Care, Connected Health Devices and Services, and our Smart Watch Market Assessment. For more information on Parks Associates Health Research, visit the Parks Associates website or contact sales@parksassociates.com.
Okay, great. So very excited to dive right into our interactive panel talking about smart home and consumer health, creating new value. We have a great panel of industry experts. I'm going to invite them each in to introduce themselves, tell us a little bit about their organization before we dive into the discussion. So to get started, I'd like to introduce Greg Lilligard, who is the Chief Operating Officer at A&D Medical. Greg has driven world-class medical device product innovation and development for over 25 years, working both in the US and Japan. He began his career in the healthcare industry as an ultrasound design engineer at GE Medical and led Honeywell's remote patient monitoring business before joining A&D Medical in 2016. Hi, Greg. How are you?
Go ahead, Greg.
Hi, Greg. Can you hear us? So I think we might be having a little.
I'm well. Thanks for having me, Jennifer. Glad to be back.
Oh, wonderful. Great. There you are, Greg. Wasn't sure if you could hear me there. So we can hear you.
Yes, I can hear you.
Perfect. Tell us a little bit more about A&D Medical to give a little context for our audience and your role there.
Yeah, certainly. So A&D Medical is one of the largest manufacturers of of in-home use blood pressure monitors and weight scales. That's relevant to today's topics. We also produce professional lines as well, but we were the first company that invented a digital home monitor that was suitable for home use. You'll hear from several of the speakers today the importance of the testing and the validation of these devices. So that's been a hallmark of ours as well. We've been in this industry for over 40 years. We, in conjunction with Boston Scientific, had the opportunity to introduce the first home-connected blood pressure monitor as well. And as I said, now we're offering a full line of different devices. But for today's topic, we'll stick on those connected devices that play a role in the smart home.
I heard you, I saw you speaking, Jennifer, but I couldn't hear you. So I don't know if you can hear me. My name is Cassie Morris. I'm really glad to be here. I'm not entirely certain of what the lead-in was. So I lead strategy and innovation for Sleep Number, and I joined them just late last year from the medical device industry to really advance and accelerate their movement into connected sleep and sleep health leadership. So what we'll talk about today is really the evolution of sleep. We've heard a lot about it this morning just from the other speakers, and the importance of sleep on your overall health and wellness. Our goal is to really deliver higher quality sleep and to deliver proven quality sleep. So we'll get into the component of how we're growing from a health and wellness from a scientific perspective as well. So we're moving from what you think of us today as just a superior sleep surface that provides individual adjustability, but we're really broadening into how this plays into the physiological barriers of sleep, what's getting in the way of your very best night of sleep, and then moving into that future that we talked about this morning with the bidirectional connectivity with the healthcare system to be able to really do proactive and predictive measurements of your health based on metrics that we can measure while you're sleeping. So really excited to be here and hoping we've got our audio.
Well, I don't know if you can hear me yet, Cassie, but we heard you just fine. And so we'll be working with you on the side to try and get that audio back, and they'll send you some notes. I don't know if you can hear me, but we heard you great. So thanks so much, and we're so glad that you're here. Next up, we have Lisa Reel. Give us just a minute to bring Lisa in here. So Lisa is the Director of Marketing and Strategy with Aprilaire. She has more than 25 years of marketing experience building consumer-driven brands at Fortune 50 global consumer products companies, including Dow and P&G. Since joining Aprilaire in 2016, Lisa's focused on evolving the position of the Aprilaire brand to reflect its purpose of enhancing people's health by improving the air in their homes. So applicable for today's discussion. Lisa, hi, how are you? Okay, let's rock back. So unfortunately, we're having a little bit of technical difficulty with Lisa too, so we're going to bring her back in just a minute. So I'm very happy to introduce Rob Schneider. Rob is Senior Vice President of Commercial Operations with Omron Healthcare, who has spoken with us in the past, and we're so pleased to bring him back into our conversations today. Rob has over 15 years of experience working for Omron. He leads Omron sales, marketing, and product strategy and operations towards advancing Omron's weighty mission of eliminating heart attack and stroke. Rob, can you hear us? Okay, wonderful. Rob, can you tell us a little bit more about Omron and about your role at Omron?
Sure. So I've been with Omron for 15 plus years now. Really what we're about is bringing tools to people to be able to better take care of their health at home. So it's a very relevant topic from what we've heard so far today. We focus in the areas of heart health management, respiratory management, as well as pain management. A lot of today's discussions that I'll be putting forth will be around the heart health area. We've, like similar to what Greg was talking about, we've been in the home blood pressure monitoring business since the 1970s. We're the #1 recommended brand from doctors and pharmacists. We do a lot of work in this area, and I think, as Jennifer mentioned, our mission is going for zero, which is eliminating heart attacks and strokes, and that pretty much drives everything that we do to fit into that. So I look forward to sharing some of our endeavors with the team here today. We just launched a remote monitoring service, VitalSight, which I can certainly talk about, which is very relevant to the topics today. So thank you very much for having me. I appreciate it.
And I certainly look forward to hearing more about that VitalSight. So Lisa is back with us, so I'd love to introduce her again and bring Lisa back into the conversation. She's the Director of Marketing Strategy with Aprilaire. Lisa, can you tell us a little bit more about your role at Aprilaire and about Aprilaire and its business?
Can't hear.
Lisa, we're having trouble with your audio. We can see you great, but we can't hear you. So we're going to give Lisa and our team a little bit more time to work on the audio issue. And as soon as she's back and ready to go, we'll bring her right into the conversation. But with that, I would love to get the panel discussion started. I'm sorry for some of the technical issues we're having, part of the virtual events world, unfortunately, but so pleased to have all of our speakers here with us today. What I'd really love to do is to start by understanding from your perspectives. I mean, you each come from kind of a different perspective in the connected home, connected health part of the ecosystem, about, obviously COVID-19 and the last year has changed so much about how we work and live and go to school and interact with others and communicate. Have you seen consumer shifts or what evidence of consumer attitudes and shifts from consumers have you seen this year, and how consumers think about their health at home, right? Obviously there's health in the wider pandemic sense, but how they're really thinking about their home environment as a piece of their own health and well-being. So perhaps we can start with Rob there.
Sure. It's been a crazy year, as many of us know, in so many ways. I'll hit a couple of areas. I think in the business that we're in, talking about blood pressure monitoring, there has been tremendous demand that has taken off since the pandemic started, and not just on our products, but think about a year ago, any pharmacy that you went into, the thermometers off the shelf, the SpO2 monitors off the shelf. People were just buying all kinds of devices, signing up for services and things for home health based, because it became really important. They were scared. They're reading things about the pandemic, of which hypertension is an underlying condition and a serious one for COVID-19. So we've really seen this whole awakening, I would say, around self-care at home, where people are taking responsibility for their health at home. They were scared from the pandemic, but it's kind of brought this new mentality around, for a broader mass of people to really start to focus on taking better care of their health at home. Another key element that came out during the year was just telemedicine and everything virtual, as we talked about before in the session today. That very much plays into it, because now, it wasn't so readily easy to go see your doctor. So there's got to be a different way for those that have cardiac conditions and hypertension and what have you. How are you going to manage that going forward? So that was a tremendous push, the ability just to be able to use connected devices to transfer data from yourself to your doctor so they can see what's going on with you. So in a nutshell, it's really accelerated and continues to do so at this point.
Yeah, absolutely. And I imagine not only the acquisition of devices, right, but just the general familiarity that they're out there. I imagine there are very few consumers out there who even knew that a pulse ox existed that they could use and go out and get, right? And so it's really raised awareness of the devices and technology and enabling services that are available to people. Greg, to you, same question. How can you give us a perspective on how you think the end users of your products are thinking differently about healthcare access at home, or the way that they are approaching their own health and wellness for them and their own loved ones from the home setting?
Yeah, certainly. I'll bridge a little bit off of something Rob was touching on at the end of his comments. I mean, we've always known that telehealth and remote patient monitoring solutions are quite effective ways to care for individuals in the home, and the pandemic just was a catalyst to push a lot of healthcare institutions into getting more serious about maybe plans that they had drafted and started to think about as to how do you provide care in the home, to something that became a real world urgency. You didn't want your elderly patient under care trekking in just for a routine physical if you could effectively have them take their blood pressure, weigh themselves, measure their pulse oximetry in the home. So that fueled a lot of growth. I think there was always interest in it from the end user side as well, but this was a unique coupling of consumer interest and demand, and the need from the healthcare institutions to provide new ways of doing work that just led to tremendous growth for our industry. The other thing that strikes me, though, is this is not going to be a short-term thing. Thermometers off the shelves in drugstore, yes, that's an immediate reaction to people being worried about being able to take their temperature at home. But once the pandemic passes, I don't see a prolonged heightened demand for thermometers. But I do think the healthcare institutions are permanently shifting to leverage some of these solutions for providing remote patient monitoring and taking advantage of some of the new CMS reimbursement, and that's just going to be part of our lives going forward.
Yeah, certainly. That provider piece of the puzzle is so important. I'd say the years leading into COVID-19, we saw providers as actually one of the barriers to remote care, right? There were certainly folks who were, advancing and were kind of the innovators and trying to push the organizations, but a lot of physicians that were very resistant to the idea, and they've really been pushed to it. And because consumers, we know from our research, look so strongly to the guidance and, of course, advice of their specific physicians on what they should be doing at home. It's very impactful, and the providers get on board as well.
Yes, indeed.
So, Cassie, let's talk a little bit about the sleep side specifically. Actually, Karsten, just in the conversation before here, talked about sleep quality kind of going off of a cliff. We're all stressed. We're all watching way too much video, at least in my case. At night and staying up too late. Can you talk about, from your perspective, right, how has the pandemic really impacted sleep quality and how that ties into consumers, wider well-being and health this year?
Absolutely. And it was really interesting to listen to this morning, because I think we've all, now that we're paying attention, sleep is everywhere. So it's a really exciting time for sleep and the sleep industry. And this notion that I'll sleep when I'm dead is finally going by the wayside and being dismissed, which, thank goodness that people and society are really beginning to appreciate and understand the impact that sleep can have on their physical and mental and emotional health. I mean, we know that portions of your sleep cycle are your emotional first aid. And by gosh, don't we all need a little bit of emotional first aid, especially now? So I think it's just, this entire, the COVID pandemic just puts everything on edge, but I think sleep has been evolving and having a moment as far as its importance. And we've all said, oh, diet, sleep, exercise, I know I need to do those things, but we've always kind of pushed them off as, yes, I'll worry about that, but I've got these other things to worry about. But the science and the physiology is really demonstrating that sleep is the foundation. It's no longer this third pillar in the sleep, diet, exercise kind of it's more of a pyramid with sleep at the bottom, and sleep influences everything. Sleep influences your blood pressure. Sleep influences your metabolism. Sleep influences your emotional stability, your ability to perform at your best. So it's really fascinating because sleepers now are saying, well, how do I get a good night's sleep? Like, it's really hard from a behavioral. You're like, well, okay, no blue light, check. I know I have this kind of habits checklist, but how do I know that what I'm doing is influencing my sleep in a positive way? And so that's really where the demand for our sleep solution has really risen, especially during COVID, because our smart bed ecosystem is designed to deliver a effortless, superior sleep experience that modifies your sleep and the pressures on you during the night. But it also has integrated effortless sensing that takes your heart rate and your respiratory rate and calculates your heart rate variability and gives you predictive values of your sleep and your sleep health that you can then influence. So it's this, how do we start this ecosystem of this quantified self? This is the quantification of sleep and my well-being during sleep, that all I have to do is go to bed. So it's, how do we take that data and use it in a smart way and give the users insights that they can take action on? So it's more of this ecosystem of what can we measure while you're sleeping that influences so many other of your health outcomes. So it's really been a really exciting time because people are understanding it, and then we can provide value in ways to really provide better sleep for individuals.
So sleep to me is so interesting. Can you talk about how consumers this year are now weighing the features, like from the Sleep IQ technology, right? Being able to get that measurement and understanding of their sleep quality and kind of the health and wellness benefits versus other factors that go into purchasing a mattress: comfort, price, right, brand, other factors, right? So are you seeing a shift in how they're thinking about it, or how you're marketing or messaging that?
So it's a fantastic question, just because people usually, I mean, they especially think of Sleep Number as a mattress company first and foremost, but it's really about a sleep ecosystem. And people are starting to appreciate that sleep isn't just this thing I put in my room and I spend a third of my life on, or that's not what my mattress is. My mattress needs to meet me where I am and provide information for me. So people come into the store saying, I want a superiorly comfortable mattress that I can adjust, because those are the things they can appreciate and are tangible. But as they start to understand the additional components of the information that they can receive, that's all part of our ecosystem now. There's not a trade-off that's required when you come in and choose this sleep ecosystem as a solution. Obviously, you weigh it against other mattresses in the market, but we really believe that this is more than a mattress. This is a sleep ecosystem that will enable your health into the future.
Yeah, absolutely. Can you talk, just one other follow-up question for you here.
Sure.
So on the consumer kind of segments, are there folks who are more interested or more in tuned to be concerned about their sleep quality, or perhaps it's related to health conditions, that are really demanding, again, or focusing on that sleep component of their health and wellness?
Absolutely. So we segment our market into those kind of healthy living, which are the younger folks who are concerned about their performance academically, or their performance on the sports field, or that kind of group. And there's a very strong desire, especially from the young folks who understand the data and understand what it means and can adjust their performance. Then there's those kind of in the middle age who are caring for others, and they're worried about they had their knee surgery and they're trying to recover from that to get back to caring for their families or caring for their elders. So they have a different particular need state, but again, the solution isn't any different. So it's very similar to the conversation that we had earlier today. All the needs are different, but the solutions are the same. And then we're working on additional solutions for the senior population that have different bed access and remote monitoring of bed exits and things of that nature, so that you can use that to care for elderly or help them age at home better and more gracefully. So it's the same solutions, but slightly tailored to the individuality of the needs, which is really the hallmark of our brand, which is the individuality of you and your sleep and your needs.
Yeah, that's interesting. I was going to ask specifically about the senior population because bed exits, very high probability of falling at night, going to the restroom. And so for your bed to know that you've gotten out of it or to alert somebody is really impactful.
Absolutely. Yep.
Well, let me try and bring Lisa in and see if we have her audio. Lisa, can you hear me? You can hear me, but we still can't hear you, unfortunately. So keep working with our team on the side. We are so interested to hear, particularly on the indoor air quality work that April Air is working on right now. So with that, I'd love to pick up on something that Cassie was talking about being, one of an ecosystem of devices, right, in the home. And certainly there's a growing ecosystem of connected medical devices in the home that capture vital signs, whether they be weight scales, blood pressure cuffs, pulse ox, we talked about that, glucometers, smart thermometers, particularly a lot of temperature checks happening this year, some required to go to school or go to work, that you're self-monitoring your temperature. So back to Greg here, how are these devices being acquired and used today, and how do you see that shifting?
Yeah, I think Carson used an interesting term when he said frictionless, right? So there's a wide market basket of things that might be useful, but what is beginning to evolve is systems to get people the devices that they really need for their personal health. Make sure that those devices are validated and well tuned to their needs. And like everything else, there's a lot of desire to just have this show up in the home. So a lot of concepts around drop shipping directly to the patient rather than physically acquiring it elsewhere. The sort of wellness or readiness platforms that Paul was talking about in his address, I think can play a role in this, because we just really want to make it easy for the end users to get devices that they know they can rely on, begin using them in the home, and begin having that information flow. And those systems are certainly getting better, but I think there's still a lot of evolution on that front to go.
Yeah, certainly. Oh, go ahead, please.
Jennifer, I was just going to jump in and say I think I couldn't agree more, Greg, and I think it has to do with how we use that information. So we're creating billions and billions and billions of data points across this home environment. What do you do with that? What is someone who collects that information? How do they manage that? I mean, think about healthcare providers who are receiving all kinds of information about the health status of any number of their individuals. If they're not in trouble, they don't necessarily need that information. So it's how do we collate it and present it in a way that's manageable and useful to both the user and the receiver of that information, which I think is the challenge from an ecosystem perspective, because data just as a whole is kind of overwhelming and continues to get overwhelming as we create terabytes of data flowing between homes and healthcare providers.
Yeah, absolutely agree. You got to transfer the massive data into useful, actionable information, and not just get lost in. And yes, here's another collection of information, or at least raw data that no one has the time to thoroughly review.
Right. Exactly.
Yeah, certainly we've seen issues in the, let's say, home security space when you have, let's say, false alerts or too many alerts, right? And people might just turn those off. You don't want to get in that position either, right? It's about surfacing the right data at the right time when it is meaningful. So I do believe we have Lisa back with her audio. Can you say hi, Lisa? And we'll...
Can you hear me now?
Yes, we can.
Wow, and I can hear you.
Yay.
Wow, wonderful. All right. Well, thank you so much for having me and actually having April Air on the panel. We're really thrilled to be here. Our mission is to enhance people's health by improving the air in their homes. And we are focused on air purity, humidity, temperature, and fresh air supply. I've been with the company for 4 years, and I've learned a tremendous amount as a homeowner myself. And my family's had some health challenges that relate to air quality, so I have some personal experience as well as a consumer. So it's really wonderful to see how things have changed over time. And one of the ways we look at it as, people have gone from thinking about clean water and what they're ingesting in their body to clean food, and now clean air. And it's taken, unfortunately, this horrible event, this pandemic, to have this seismic shift in people's interest and understanding of how important the air they breathe is. And I was really interested in what Cassie had to say about sleep and tying that into Paul's conversation about how we interact with the environment. And when you think about your bed and your bedroom, there's a lot going on there, and you spend, as Cassie pointed out, a tremendous amount of time there. And gathering that data and feeding back everything around you in your environment, what you can control to get the best out of that time you spend in that environment. So whether it's the bed, which is clearly, as Cassie said, more than a mattress, it can really enhance your life, your performance, your wellness. But you think about, as Paul mentioned, circadian rhythm and how that ties together. And then think about the air you breathe. Only a few years ago, people were only thinking about, okay, do they have asthma? Do they need an air purifier in their room? Someone with COPD. These are things where people were reacting to what is oftentimes invisible through symptoms that were medically related and challenges they had. Now we're saying, wow, people know more about radon, the number 2 cause of lung cancer in the United States. It's invisible, it doesn't smell, but it can be in your bedroom, it can be in your home. They understand more today than ever about humidity. And we've been doing studies with consumers that are sharing how they link good sleep quality with the humidity in their body and the room they're in. So it's really fascinating how all of these things are really tied together. And by collaborating, working together, looking at the science, understanding the data, and working together to give consumers a really great experience, but that's perceivable, and they feel different. It does transform their lives. I think it's really exciting. The technology is changing. The science is proving things out, helping show the way. We need to move forward, and it's a really exciting time. So thrilled to be here, and thank you for having us.
Well, Lisa, I'm so glad we were able to bring you into the conversation. Again, this conversation specifically around indoor air quality this year has really come up to the forefront. Can you share any more about what consumers are asking for and maybe what smart products can actually do in the home, right, to address indoor air quality?
Yeah, absolutely. So we see, first of all, consumers, and this may sound very basic to this audience, but think about talking to a consumer about the system they have in their home. Oftentimes, they know very little about it. They may know they have an air filter they change when they remember to do it. It's so much more than that. And we know through we've been in business since 1954, focused on healthy air. We understand air flows and how all of these solutions work together, whether it's the purity of the air, making sure you've got that fresh air supply coming into your home. We went through a period where we were really focused on energy. So we were building homes that were super tight, but that causes sick home syndrome, right? All those things you bring into your home, and breathing and cooking and accidentally burning the toast, all of those things add up to an environment that can be really hard on your lungs and your body, and a poor, health outcomes can be what comes out of that. So those are really important things. And as the CDC and other organizations were looking at the built environments where we're spending our time and how viruses interact in those, the things that they said need to work in tandem, there's 3 things. One is purifying the air, that's there, that's circulating, making sure there's fresh, purified air coming in, and then making sure humidity is at a certain level. And sometimes we forget about that. We've got so many extremes, whether you're in an arid part of our United States, or you're in Arizona, or you're in Florida, or you're even here where I am in Wisconsin, and it's an incredibly dry, cold winter. I know you guys are all jealous you're not here, or you weren't here in January, or you're here in July and it's very humid. So we understand that keeping humidity between 30 and 60% relative humidity is really key to having a healthy environment and minimizing bacteria and viruses in the air and transmission. So there's been a lot of work done on those three pillars: fresh air supply, purifying the air, and then keeping humidity at a certain level to maintain a healthy environment. And keeping those things all working together through sensing what is going on in the environment and having the data and the controls and algorithms to make adjustments to changes, because the inside of your home is influenced by what's going on outside of your home, of course. So continuing to make adjustments, and then understanding what the needs are of the person in the home. So there are people with medical conditions that need a certain home environment in terms of air quality, and some people like a different environment for comfort, or for things that they're storing in their home, whether it's fine instruments, they have wood floors, they have a basement. All of those things play into this, but creating that healthy environment takes those three things, and it's much more defined. And then we have all the data to tie all those solutions together so they can work automatically. And then we're working on how do we collaborate that and plug into the other parts of the smart home, so that we can, again, create this healthy and really great experience for people living in that home.
Yeah, I think that's one of the key questions for all of our listeners today, as well as for you guys, that you're working on different products that are connected products in the home that may address slightly different conditions or pieces or factors in the home, right? You all have very meaningful data to share that may improve each other's understanding of what's happening. I'm very interested in insights on how you partner with others or work with others, or what other devices or parts of the home ecosystem you see as being particularly valuable to know. So is it occupancy sensing? Is it, moisture in the air, right? Is it understanding the weather patterns outside and sensing that, right? Maybe we can actually go over to Rob for this. You're coming from again, more of the medical vital sign sensing, and I would love to hear about the vital tracking that you mentioned earlier, but then also your take about integrating with kind of other devices in that home ecosystem.
Yeah, so I think, a couple things from what everybody's talked about so far. A couple of themes came in that in all the industries or product areas that we're involved in, there's been a lot of new people coming in the last year for various reasons driven. And I think one of the key elements that have come out is simplicity. It's got to be easy to use for people to be able to understand it, set it up, whatever it has to do. Education has been really important as well, in terms of people are running out and buying products, services, and what have you, probably a little bit faster than maybe what they would have before. So are they getting all the accurate information to be able to do that, I think is an important consideration. So just a couple of themes that have come out. That kind of plays into a little bit, you mentioned Vital Sight, which is a remote patient monitoring service. This is very much a medical-based service for people at higher risk or have higher levels of hypertension that really need to be managed more closely for obvious reasons. So it's a service that we're working with Mount Sinai in New York, Northwestern Chicago area. It's very much through the physician, the hospital, with the patient, to be able to monitor in a much more comprehensive, frequent way at home. And it's very much, a kit shows up, you plug it in, you've got your monitor, the data goes back and forth with the physicians. They have a dashboard that they can see, so you can see people that are going in and out of range, all the things you would see in a remote monitoring service. And we've been working on it for a while, but I think it's become really relevant in the last year when people were not able to go see their doctors as much as they would have liked to, just so the doctor has the ability to understand, for the industry we're in, that's very important about what's going on with you at home when they maybe can only see you every few months and what have you. So I think, from a pure medical perspective or clinical, that's kind of what we're about. I do think there's a lot of opportunity in the discussions today about, air quality, sleep quality, all these different types of things. At the end of the day, that can start to affect you in some direct ways, respiratory conditions and things like that. There's cardiovascular implications for some of that as well. And it all starts to add together. So I think, there's a lot of individual, mini ecosystems today. It's a matter of how those start to come together. In cases that are truly valuable for the person living in the home, or their family members or doctors who are helping treat them from somewhere else. And I think that's where the future is going to be going for sure, is how does all that start to come together?
Yeah, just as a follow-up there, one of the major issues, of course, with sharing data, you've got major consumer data privacy concerns. With health data specifically, and the type of data that you're working with remote patient monitoring back to a physician, you've got HIPAA, which is a whole other level of consideration there. Can you, I'm assuming that will continue to be a barrier, but do you see any kind of innovation or ways to kind of cross this barrier? I mean, part of it is maybe putting it in the consumer's hands to allow permissions and allow sharing, but it's very hard as a consumer to understand exactly what's happening with your data and who sees it and where it goes.
Yeah, I think for what we have right now, both through the VitalSight program, which is an official service, as well as our mobile apps that connect to our monitors, everything is in control of you, where you want your data to go. You can choose if you want it to go to your doctor or if you want to go to your family caregiver and what have you. It's very much in your control. I think as things start to integrate more with other devices in the house, from a medical perspective, I think HIPAA has to stay. They're going to have to be HIPAA compliant systems in order to be able to really transfer data. I don't see that changing. And I think if anything, people have become even more concerned about security, when they have devices in their home, they have Alexa in their home, all these things that they're worried about. Where is this information going, and where could it go? So I think HIPAA is going to be a strong component for any integrated data solutions I can see.
Yeah. Cassie, if I could come back to you on this actually. So thinking about sleep number and all of the different factors in the home you spoke about that impact sleep, right? Are you integrating already with folks in smart lighting and smart thermostats or ceiling fans? Can you talk about any of the integrations that you're working on, or what you'd like to see happen in this?
Sure, absolutely. So I see us as Sleep Numbers kind of firmly between these two universes. We want to integrate with the smart home in a way that is meaningful. So if it is smart lighting and it's managing your circadian rhythm so that your sleep health is impacted, that makes a ton of sense. But then I would also say that we want our future is connectivity into the healthcare space. So it's how do you take this consumerization of healthcare into the home and manage it in a way from a predictive and proactive fashion. So integrating and advancing our sleep IQ, and we're transforming it into Sleep IQ Health to say, okay, your respiratory rate was up last night, or longitudinally for the last month, we've seen your respiratory rate rising. Perhaps you are catching a cold, or your temperature is elevating. There are things that we can monitor just while you're sleeping effortlessly without putting anything on, that we can then tie into that health ecosystem. But to Rob's point, the evolution of the space is really about that ease, but it's about accuracy and trust. The accuracy and trust of, what are you doing with my data? What are you telling me? What is your algorithm doing? I mean, all that we've talked about is we're taking data and we're processing it. Individuals really want to know, well, what are you telling me? What is that made up of? How do you do that? And a lot of algorithms are trade secrets. So you've got to build the trust with the individuals that what you're providing to them is as accurate as what they would get in the healthcare setting, and that it's tied to things that matter in the home. So it's this universe of how do we pull all those pieces together in a trustworthy way. But I do agree that data management has to shift more towards healthcare and HIPAA compliance, just because that's what the customer is going to demand now that most of the healthcare stuff is coming home.
Yep. Well, I'd love to remind the audience that you can get some questions in for your speakers, and I'll make sure to save some time to pull in those questions. But also we have a poll to our audience related to the biggest barriers to growth of connected health solutions, particularly in the home. And so if you haven't had a chance to get over there and log your opinion, I'm going to pull the results in just a moment. But I'd love to maybe turn back to Greg here about the barriers to connected health solution adoption in the home. You spoke about how really there's been a huge increase in demand for these devices. So really the market has accelerated enormously in the past year, but there certainly remains barriers to familiarity, to adoption, to understanding what these devices do. What are you seeing from your perspective?
Yeah. So we certainly agree that this past year has really had people take a closer look at this. I think a lot of it is just familiarity, and standard of care takes time to evolve. Even when there are alternative paths that provide really a better healthcare experience for the individual in the home, that doesn't necessarily make the top of the average healthcare institution's list of things to do. They are dealing with so many problems on so many fronts. But I think as we as a society just become more sophisticated about this, it's going to be increasingly well accepted. Just a small personal example. My mother-in-law had some heart valve problems that she recently needed to get taken care of, and she's got early onset of Alzheimer's, so she's beginning to suffer some dementia. And all of this came up within the past year when she didn't have access to her doctor, and she has not been an overly interested in technology, right? So things like having a Zoom call with her physician would have had zero appeal for her. But circumstances just forced her to explore it. And then she came away right away with, well, this is just much better. I don't have to travel. I don't have the stress of getting there. I think that the physician spends more time interacting with me and caring about what I have to say rather than just rushing between patients. She just was 180 degrees turned around after a single experience and said, well, this is the way it should always be done.
That's so incredible to hear that personal anecdote, because that actually aligns exactly with what our research has found. So going into 2020, older consumers were absolutely the most resistant to telehealth type services and remote consultations, and very, very strong bias towards in-person healthcare with their physician, right, that they trust. And on the back end, we found that seniors who have tried it had higher satisfaction rates than younger consumers actually, and came away like, oh, okay, maybe the expectations were lower, but it's really interesting to hear that. So thank you for sharing that anecdote. Just to get the results of our polling here. So what is the biggest barrier to growth of home connected health solutions? The options were low awareness, cost, lack of integration with the rest of the healthcare ecosystem, and poor user experience. And few people checked cost or poor user experience. 47% said lack of integration back with the rest of the connected healthcare ecosystem, and 40% said low awareness, which I think we've touched on actually in both ways. So Greg, perhaps no surprise back to you. That's what you were talking about here.
Yes. Yeah. Certainly, we see all of those, and then sometimes in rural areas, it's just there's no effective way to connect. So it's partly the cost equation, partly the IT infrastructure piece of it that it's just more difficult sometimes in our more rural areas to have a nice clean path to get any of this information back.
That's a really good point too, and it's one question that I was hoping to get to Paul Shala during his talk, but we ran out of time. Is there are certainly oftentimes the newest technology, right, and the newest approaches reach luxury level of the market when it comes to buildings and homes, right, or higher income consumers. Can you talk any more about maybe initiatives that you've seen or ways to get connected health and telehealth and solutions that are really impacting consumers' health and wellness at home into more underserved populations? And happy to come back to you, Greg. Yeah.
Yeah, I mean, actually, there's a fairly sizable federal grant attempting to do just that work right now, specifically for cardiovascular health, just looking for ways to get to underserved populations. I mean, the good news is the overall cost of this technology is coming down. So while there's an immediate perception and a concern about how complex this is, there's just an increasing number of ways to provide pathways to get this information back. And they don't all rely on somebody having, the very latest and greatest iPhone to serve as a conduit to push the information back. So I think that's just going to continue to expand. I think, as all of our industries innovate, we'll find more ways and more cost-effective solutions to, provide the basic data path to, deliver the information to the individuals who, need to review it and provide advice back to the user in the home.
Mm-hmm. Lisa, I'd love to come back to you specifically on indoor air quality and maybe the challenges to getting solutions into homes, right? So there's been this great growth in awareness forced by tragic circumstances, right? So that awareness is rising. What barriers still exist to improving air quality in the home? Obviously, you've got new build versus refurb, you've got different segments of the population. What do you see as the main challenges ahead?
The industry is basically just going through a huge growth spurt, and we had a good chunk of the country for part of the year shut down where people didn't want anyone in their homes. And this all starts for us with an expert, an HVAC contractor that can come in and know your system and can help you figure out the best way to add indoor air quality solutions to fit your actual home and what you have and what your goals are. So I would say the biggest barrier is just bandwidth with this surge in demand, and that's, of course, short term. But as people are looking for solutions, it's having things that fit with what they have in their home. And then for us, it's staying very flexible so that we can interact and collaborate with all kinds of different partners to be respectful of data, but be able to share the things that help us provide, again, a great healthy environment and great experience for consumers. So I hope that answers your question.
Yeah, certainly. Can you speak also to maybe what you expect as far as ongoing demand for indoor air quality solutions? Obviously, this is probably the absolute peak, right? Coming out of this very real experience to all of us. Eventually, we hope, knock on wood, I don't want to jinx anything, but we'll get past this particular crisis in time. Will this level of demand continue, or do you expect it to evolve or fall off in certain ways?
I don't know. Great question. We've certainly been keeping an eye on that, and we see this as something that is here to stay. Sure, it's just like people who went online shopping and didn't visit their brick and mortar stores as often or in the same ways. They're going to keep shopping online and maybe mix in a little bit of their old habits. We see this the same way. People are going to be interested in a healthy indoor environment, and they're wanting to stay healthy and understand much better how things are transmitted in terms of viruses and bacteria and so forth. So we do see that things will level off a bit, but we see a very bright future and strong growth. Paul mentioned new home builders and the focus of consumers on looking for builders that understand how to create a healthy home, whether that's indoor quality and beyond, but that focus on providing a product that has a value tied to health benefits is it's really big in the market, and we expect that to be growing. Also, the mention of certification. Has science been used and experts looked at the building plans and determined, the right mix of products and structure to build a healthy environment for a new home? Those seals of certification are becoming more and more important to consumers as well, and they're looking for those when they're making purchase decisions. And then, of course, the biggest market is existing homes. So being able to come up with solutions that can be integrated into existing homes is a big and growing market. And that takes sometimes a different approach in terms specifically of indoor air quality. But we're looking at the flexibility needed there to fit into existing systems and grow from there. But we expect consumer demand for all of that and interest to continue to grow strongly into the future.
Absolutely. Now, I did want to pull in one question that we got from the audience, which is always a hot topic, which is about the role of the tech giants in healthcare and in the connected home ecosystem. Obviously, they have each of them have a different piece of the pie. We saw Amazon coming out with Amazon Care and telehealth services to the home, as well as their own channel. Apple's particularly strong in wearables. I mean, the Apple Watch is really the wearable, among others, but and Google as well. So can you talk at all about when you're thinking about your own product strategy and your own business strategy, do the tech giants lift all boats? Is it competitive? How do you think about working with the tech giants? Does anybody particularly want to jump in on this one? Because I know it can be a hot topic. If not, I'll direct it. We're all hoping I avoid you. Rob looks like he's going to jump in. There you go.
Sure. I can jump in just real quick. It is, for all the companies that we're in, it is a classic. Yes, we compete with the tech giants, but we also have to play with the tech giants as well. So I think a lot of it, when we look at what Greg and I have talked about today, blood pressure monitors and things like that, technology is moving forward for sure. It still has a ways to get there in terms of less invasive ways to do that. But I think all of our companies have to embrace, how do you make things better, more valuable, easier to use? So like for tech giants, wearables falls right into that. So there's ways to get the same data. How do we work with them in terms of, we're experts in this field, and how do we work with the tech giants in a partnership way to be able to take that and make it more valuable for the consumer in the end? Because that's really what it comes down to at the end.
Absolutely. Well, we will end on that word. Thank you, Rob. Thank you, Greg, Cassie, Lisa, very much for your time today and for your insights. It was a pleasure to have you all on this panel. I want to also thank our sponsors, Alarm.com and Everrise, for supporting the Connected Health Summit and making sure we can get all this great content for you. In fact, Everrise is sponsoring our networking break. So as a reminder, our team is putting a link to our Zoom networking discussion room into the chat if it's not already there. And you can follow that link to really hop right over to the networking discussions, which will run for about a half hour. And then we are back here at 12:30 Central for our afternoon session. Just a reminder that we do have our new study on indoor air quality available. So if you're interested in that, please reach out to us. Our sales team is certainly here to help you if you have any connected health and independent living research needs. Alyssa Mancini, Jason Paris, and Caitlin Silvestri are all here to help you understand what research we have and how we can help you. So again, up next, we're breaking out into the networking discussions, and then we're back here at 12:30 for another full session on seniors and caretakers serving a massive population at home. Thank you.
Hello, I'm
I'm Jennifer Kent, Vice President of Research with Parks Associates, and I'm so pleased to be joined today by Ann Ferguson, who's the Vice President of Marketing with Alarm.com. Hi, Ann, how are you?
Hi, Jennifer. I'm doing very well. Good to see you today.
Good to see you as well. Thanks so much for sharing your time and insights with us today. We wanted to learn from Alarm.com's perspective, from your perspective, what industry and consumer trends you're seeing that are really shaping the residential security space right now.
There are so many. It's really been an exciting time to be in this space because there are so many technological advances happening at the same time. Consumers are really ramping up their adoption of security and smart home services. So really exciting time to be in this space. And a couple of the things that we've seen evolving over the last year plus, and that we think will continue for the next year, are around things like thinking beyond just perimeter protection. So historically, as consumers thought about security, it was primarily around protecting the outside of their home and making sure bad guys didn't get into the home. But increasingly, smart home services are able to help consumers protect everything inside the home as well, and to understand what's happening inside the home. So whether it's protection from water damage and leaks or mold in the home, for example, there's just new ways of thinking about protection beyond just that very traditional sort of perimeter protection, which is obviously still very important. Another area of tremendous growth, I think not surprisingly, has been in video. Certainly newer cameras and technologies like video analytics that make video services so much more useful for consumers have really helped to drive demand. And certainly the doorbell camera has been a tremendous new use case for consumers. And the adoption of that service has just been, I think, beyond what really anyone would have imagined. But what that's done is it's also gotten consumers thinking about other ways that video can be useful. And in particular, we're seeing an increased adoption and excitement around other interior video use cases. So, similar to what I was saying about security, video for a long time was just used for exterior perimeter protection. But now, especially these days, when a lot of us are still at home, we are working from home, we are schooling our children from home, thinking about indoor video use cases where I can do things like be in one room of the house, but quickly use video to check in and make sure that my kids are actually online and in school the way that they should be. A year ago, that's not something that I would have considered, and now it's invaluable to me. So I think we're starting to see a lot more in the way of utility around interior video use cases. And then one of the last areas that really has an impact on everything that we're doing is thinking about the impact of AI and how that is fueling so much in the way of efficiency and greater usefulness of smart home and security services. And I'll just give one quick example. One of the features that Alarm.com offers is called unexpected activity alerts. And with that feature, the system in the home starts to learn what normal patterns look like. And then when anything unusual happens, you'll automatically get an alert about that. So for example, early on in COVID, actually, it was one of the first days that we were home, I got an unexpected activity alert that my patio door had opened in mid-afternoon, around 2:00, I think. And that was very unusual. That wouldn't have normally happened on a weekday, but the system recognized that was unusual and immediately let me know. And the great thing about that is I didn't have to set up a whole lot of complex rules to get that notification. The system just automatically knew and it was able to understand what was normal. And when something unusual happened, it let me know very quickly. So again, just an incredibly useful feature and something that is a good example of how AI is really making smart home more useful, accessible, and I think safer for consumers as well.
Yeah, one of the knocks on the earlier generation of smart home solutions is that they may have been connected but not smart yet.
Yeah.
So are you seeing the technology evolve such that it is becoming more intuitive and intelligent and really solving some pain points for consumers?
Absolutely. And that's, I think you hit the nail on the head in terms of where AI can really be beneficial for consumers. One of the other things that we've seen really significant adoption of has been a feature called Scenes, where it's very simple, but it's just a single tap in the app that allows multiple different things to happen at the same time. So for example, a wake up scene. I can simply tap in the app and then I can have relevant doors unlock, the security system can disarm, certain lights can turn on, and it just makes it easier. That's one tap instead of 4 or 5 taps, and I can customize those scenes very specifically to my home, my family, and to our needs. So, rather than having to open up 5 different apps to do 5 different things, I've got this singular experience where all the different smart devices are working in concert with one another to deliver a great experience for me.
Yeah, and that ease of use and the customization is really where the rub has come, because no household's the same, no house layout is the same. Different households have different numbers of household family members, and so trying to make it easy to customize is really a difficult thing. Well, what do you think the next phase in the smart home looks like?
I think it's going to be a continued evolution of bringing more and more into the fold. If we go back probably 5, 6, 7 years ago, I don't think that most of us in the security industry could have imagined that we would be talking about water protection solutions, for example, or connected car solutions. But we really are able to take so many different mission critical systems in the home, and now even with something like car outside of the home, and connect them all together. And we're really excited to continue to see that happening.
Yeah, that ecosystem does seem to continue to grow and expand and push the boundaries of what's included in the smart home. So very exciting to watch. Thank you, Anne, for joining us today and giving us a little bit of your thoughts of how this market is shaping and growing. We appreciate it.
Absolutely. Always happy to talk with you.